Welcome to Airway Breathing Conversation, a podcast presented by the anesthesiology residents at the University of Saskatchewan, created to provide individuals of all levels of medical knowledge with anesthesiology-related healthcare information. This episode is part of our Abridged Ground Round series, in which highly knowledgeable and sought-after guest speakers present on a multitude of fascinating topics relevant to anesthesia. Join us for Ground Rounds this week, where Dr. Leah Ferguson, an associate professor within the College of Kinesiology at the University of Saskatchewan and certified mental performance consultant, discusses performance optimization and practical performance enhancement tips for individuals in healthcare. Please note that due to technical difficulties, sections of this presentation unfortunately had to be removed. Now, whether you are an anesthesiologist, resident, medical student, or member of the general public, come listen in as we demystify the incredible specialty that is anesthesiology, one episode at a time.
Yeah, super excited to be here. I don't want to repeat what was said in the introduction, but just to lay a little bit of context here, right? So I've titled my presentation, Building Your Toolbox, Navigating Setbacks and Enhancing Mental Performance in Medicine. Nothing in my bio had anything to do with like healthcare or medicine, right? Like you're like, who is this lady coming in here to talk to me about mental performance in this domain? And you're probably like, what does she know about the healthcare profession? Well, the answer is very little. But what I do know a thing or two about is how to optimize our performance in any domain, in any context. And so I really see any professional domain, particularly healthcare, medicine, as a performance context. You're performing, right? And so I've really prided myself in my research and in my applied work in finding ways to optimize performance. And that's not just thriving and flourishing, it's also how am I navigating those setbacks and those failures that are inevitably going to come. So we're going to talk a little bit about all of that today. And I've gained this experience from, again, in the sport field, but working with athletes and teams and coaches everywhere from that grassroots developmental, so we're just learning how to do this phase, all the way up to athletes and teams that are competing nationally, internationally, and professionally. So I have quite a range of experience, and this is actually my favorite part of what I do, is actually like translating it into meaningful stuff, not just writing the papers that I need to do to get promotion, right? Which matters too. So delighted to be here. The other thing I want to say, nobody wants to sit here and listen to me for just an hour. Like nobody wants that. So we're going to go for audience participation during some of it today. I'll be asking you just to like chime in with ideas. I'm sorry to everyone online, that's probably not going to be the most useful way to do it, but folks in the room, you can shout out ideas when I have questions, just like old school class, right? And then I'm going to get you to do some applied work yourself. So I'm going to kind of turn it over to you, some individual self-reflective-y type activities, so you can try out what I'm talking about today. So you don't just kind of osmosis think you can learn it through 1 hour and then move on. So I'll get you to try out a few things. And I thought I'd start to try and contextualize it with an opening scenario. So I'll read through this opening scenario for you. So we have Dr. Alex Thompson. Dr. Alex is a third-year resident in internal medicine at a busy teaching hospital. Known for their dedication and strong academic performance, Alex has always been passionate about providing the best care for their patients. However, the past few months have been particularly challenging. Alex has been managing a complex case involving a patient with multiple comorbidities. Despite Alex's best efforts and countless hours spent researching and consulting with colleagues, the patient's condition has not improved. The patient's family is growing increasingly frustrated, and Alex feels the weight of their expectations. One evening, after a particularly grueling shift, Alex receives news that the patient has taken a turn for the worse. The attending physician questions Alex's management decisions, and Alex begins to doubt their own abilities. The stress and self-doubt start to affect Alex's performance, leading to a series of small mistakes that further erode their confidence. Feeling overwhelmed and questioning their future in medicine, Alex wonders if they are truly cut out for this profession. They struggle to find a balance between their professional responsibilities and personal well-being, and the fear of failure looms large. So there's our opening case. My question for you folks in the room: what would you say are the issues in this scenario? So like what jumps out at you as concerning, problematic, just a key issue? Self-efficacy in regards to the ability to actually deliver what Alex needs to be delivering. So confidence in his ability to perform. Good, thank you. So self-efficacy. Nice. Look at this. I get to learn additional insights as well, right? So lack of support for sure being happening here, right? So Alex is perhaps not getting the support and guidance that's needed, should be able to perhaps get more input, do what Alex can do, and then pass it on to who's next, perhaps. So the supports might not be in place. Good, thank you. Self-efficacy, I'm going to summarize that as lack of supports, but your answer was much more articulate than mine. Henry. Absolutely. So how is Alex interpreting or internalizing that feedback that he is receiving about management decisions, things like that? How is it being internalized? Is it leading into things like self-criticism and self-doubt? Even if, as you said, the intent isn't for it to be that way, it still might be internalized in that matter. Good, thank you. Good. So the weight of the expectations beyond just Alex's own expectations, but the weight of the expectations or pressures from the family, from the attending physician. So there's that weight that could be impacting Alex as well. And how is that impacting their ability to perform, I'll say. Good. Any others? Good. So the balance of being empathetic, but losing that, I don't want to say distance because that maybe sounds like a bad thing, but maybe that protective emotional distance. So maybe that's being missed here, or there's too much of a lean in, I might say. Good, thank you. Good. I was not looking for any like surprise. I'm not gonna like have a surprise hidden like, aha, here's what the issues are. It genuinely is like what's landing with you. You folks live this closer to than what I could live. So I wanted to get from your perspective, what are the issues here? So my next question is, so what does Alex do? How might Alex proceed? What are options? Talk to your colleagues, so talk to someone. And so when you say colleague, paint a picture for me, and I don't live in this world. Who's a colleague? What's a colleague? What are they going to do? Good. Co-resident, attending, I think I heard you say a director. So talk to others, get that other support that was mentioned that was maybe lacking. Thank you. Good. So kind of piggybacking on that previous comment of important to take an appropriate amount of distance from the patient, perhaps hand over the primary care to someone else. Good. See, again, I'm learning as I'm going through this. This is good. So maybe Alex can be a little bit reflective on this incident a little bit, right? So what's going on here? What are the strengths that I have? What are the areas for improvement? How have I received feedback in the past? What other feedback have I received? How have I learned from that and grown on it, right? So I might refer to that in my sports psych world as like that self-assessment, right? What are my strengths? What are my areas for improvement? We're going to do an exercise on that a little bit later, just so you know. So good, thank you. Yeah, thank you for that. I really like that response. That kind of like summarizes all the pieces that were shared, right? So to know our strengths and weaknesses, we need to have that self-awareness. Where am I at? How am I navigating this? Perhaps in connecting with a colleague to receive that support might help them become aware of where they're at. Do they need to just step away? And then reflecting on that, do I need to take more distance? Do I need to hand over the primary care of this patient? Good. So we've identified a scenario. We've tried to come up with some potential solutions. Throughout the rest of, I almost said today's class, I feel like I'm back in the classroom. The rest of today's talk, we'll talk about some potentially additional things that Alex could be doing, kind of more the mental psychology side. So I like that a lot. Well, not that all of ours went to the practical side. There was kind of a combination of that mental psych side of it, but then also that like practical, tangible, how do I actually move forward in this, this case that involves other humans as well. So in this scenario, what we really saw was a demanding experience, right? A setback, dare we say a failure. And if there's one thing we can all relate to, other than, what do they say, taxes and death, it's failure, right? We all experience setbacks, demanding experiences, failures, whether it's in our personal lives, our professional lives. For instance, in the scenario we worked through with Alex, we can all relate to having gone through these difficult experiences that we might label as a failure. So I want us to start thinking about just personally, and I'm not going to ask you to contribute these answers. These can just be for yourself. But I want you to think about, how do you typically respond to, and I'm going to use the word failure, I might use setbacks interchangeably, but you can be thinking, contextualizing that in whatever way makes sense for you. How do you typically respond to failure? What's kind of your go-to response when you fail or you have a demanding experience or a setback? And now just bring to mind, if you were going to change how you responded, or if you wanted to, how would you want to respond to failure? Right? Is the way you're responding to those setbacks and those demanding experiences the most adaptive, the most constructive, or is there maybe a little bit of that, maladaptive, destructive responses that happens when we experience those demanding setbacks and failures? So that's to kind of contextualize where we're going, that when we experience failures and setbacks, what are the options that we have? And that's sort of what the opening scenario was intended to do as well. So I'm going to be bringing in the coping literature, so the sports psychology coping literature, to talk about how we might navigate through demanding experiences and setbacks. And these are sort of loosely categorized into 4 areas, really just for sake of organization for today's talk. So managing setbacks and failures, one way we can do that is to try to reduce our emotional response. So those are referred to as reduction approaches. So we want to kind of get a handle on emotional regulation when we are going through those demanding experiences or those setbacks. We can do what's often referred to as emotion-focused coping. So again, leaning into more of that psychological, mental performance response, in addition to a lot of the practical strategies a lot of you folks identified too. So we could be doing relaxation exercises. I'm sure many of you in the room are familiar with various relaxation exercises. Meditation, there's many guided meditations out there to try and calm our emotions. And diaphragmatic breathing. I'm a really big believer in diaphragmatic breathing once somebody has sort of mastered it. So I have a video that we're going to watch, and we're all going to do some diaphragmatic breathing. I often do diaphragmatic breathing with athletes, and what I actually often get them to do is we're not going to do this. We could, but we're not going to. I have them lay on the ground and actually put their legs up the wall like a waterfall, just to kind of really help them to trigger that relaxation response, and to help them be able to actually do diaphragmatic breathing. So I have instructions on it, but rather than do instructions, I thought we'd watch a video.
The first exercise is diaphragmatic breathing. Your diaphragm is a muscle that helps you breathe. You can find your diaphragm by placing a hand on your upper belly and giving a quick cough. This exercise helps to strengthen your diaphragm muscle, decrease your breathing rate, and allow you to breathe with less effort. Start by getting into a comfortable position. Lying down is preferred, although sitting up works as well. Rest one hand on your belly and one hand on your chest. Close your eyes and relax your mind and body. Take a few breaths and notice how your hands naturally rise and fall. On your next inhale, breathe in through your nose, trying not to let your chest move. Notice your belly filling up with air like a balloon. As you exhale, notice your belly lowering. Try not to force this movement. It takes practice. You should try to do this exercise for 3 to 5 minutes.
So diaphragmatic breathing. I'm guessing many of us in the room have heard of diaphragmatic breathing before. I often use it with athletes to help them get a handle on their emotions, to reduce their emotional response to a demanding experience or to a setback, right? So if they can get a control of their breathing, they can likely calm down. And if they're calming down the body, with it can become calming down the mind. So it can be a really good way to reduce that emotional response. I was working with a varsity track athlete once who we've been working on breathing because he was finding it was really working for him to calm him before a competition. And he came into my office one day right before we were having a session. He's like, guess what? And I was like, what? He's like, I tried that breathing stuff before I had to give a presentation in a class, and it worked there too. And I was like, yeah, it's not just for sport, right? Like he kind of had this like mind blowing, like I can do this in other areas too. So I usually progress through working with athletes. The hand on the belly and chest is a good place to start, because usually if I'm with a group of young athletes, I say, okay, now everyone take a deep breath, and they go, they do this like exaggerated shoulder move, and I'm like, well, you're really probably shallow breathing when you're doing that. And if we want to trigger that relaxation response, we want to get it down to the belly. So they work their way up to not having to have have their hands on here. So the athlete I was working with could just be standing to present next and doing diaphragmatic breathing to calm down his emotions. So maybe that'd be beneficial for Alex as a coping tool. Not going to say that that's going to change the trajectory of the patient's outcome, of course, but to help manage perhaps some of that internalization, those pressures, those expectations that he's feeling, to just calm the emotions that are probably building up and contributing to additional errors that are being made if he's getting more and more wound up. So reduction approaches. There's also ways that we can restructure this scenario. Now, that doesn't mean I have a magic wand and I can poof, Alex's patient is magically healed. Of course, you all know that, right? But how can we restructure how the scenario is being interpreted, right? So with that, we could be doing things like intentional goal setting. So Alex could perhaps be working with a mentor, a teacher, a coach to sit down and go, okay, what are my goals for this? And I don't mean goals necessarily in healing the patient, because I don't know anything about primary care, but I just mean goals maybe for himself, for mapping out how am I going to navigate my next steps in this scenario. So goal setting could be one way forward. But we're going to do an exercise that I call the recipe exercise for self-assessment. And so I do this is usually one of my first exercises with any athlete or team that I'm working with. And what I get them to do is I get them to draw a line down the middle of a sheet of paper. And I get them to, I always say, we're going to start off in a bad place, but don't worry, we're going to come out of it. I say, I want you to articulate for me, bring to mind all the ingredients, all the things that if you were going to perform at your worst, what does that require? What's happening to make you perform at your worst? What are all the different ingredients that if they came together, you would fail, you would perform horribly? So let's hear some of them. If you were going to be at your worst, and you can be thinking personally, professionally, whatever here, what are you doing if you're performing at your worst? Let's hear some ideas. And then I'll put up some examples too, don't worry. Good, that's on my list. I love it. Not sleeping. Excellent. My husband was snoring since 3 a.m. this morning. I was like, buddy, I gotta get up early. So not sleeping, right? Rest. We need rest to be at our best. So if we're not rested, we're probably performing very poorly. Good. Others, thank you for getting us started. When we're at our worst, what are we doing or not doing? So being distracted and pretending we can multitask is how I say it. But yeah, overstretching our abilities to do that, because I can only imagine you need to multitask a lot. So pushing that too far. Good, thank you. Good, negative self-talk in our own heads, right? That inner dialogue, what's the little voice saying to us? And so I always say it's not always like fully articulated, flowing sentences and paragraphs. It can be fleeting thoughts that just crush you down, right? So yeah, negative self-talk. Good, thank you. Not good, but thank you. Aha, negative from self, from other people perhaps. But you bring up such a good one, right? So the environment that we're in, right? So what is the environment? Is it conducive to us being our best or being our worst, right? So yeah, it could be external self-talk, either from ourselves or from others. If we're getting external self-talk from others, what is that potentially doing? If we're getting external negative self-talk, is that leading to other things that would be your worst performance? Good, right? So high anxiety, absolutely, right? And that's a good point, because you could be unprepared. I'm not ready for this. I have not done the research. I'm not equipped to be here. Or maybe you did, but you still feel unprepared. And I feel like those are even two different things. Thank you. Poor communication. Did you see my slide deck too? Because that's going to be up there as well. Tell me what you mean by poor communication, though, because I was trying. I'm like, what would be relevant to this context? So poor communication between or with. Good. So not communicating with everyone around you, whether it's your colleagues, the patient, the family. What do you mean by poor? Is it quantity of communication, or is it quality of communication? What makes it poor communication? Is it just you are or you aren't? Good. Yeah. So it might be you're not communicating enough, or it might be my husband is a terrible communicator. I'm like, I don't know what that means. You need to tell me what that means, right? So the quality, are we clearly articulating things? Good. Quantity, quality of communication. Good. I came up with this stuff. Some of it we said, I got to be able to read this, sorry. Minimal sleep. I love that that was the first thing said and I had it up there. We're all being fed right now, right? So I know I'm better when I'm fueled. I just use the word fueled, right? Grabbing another bite to eat right now. That's great. Maybe it's feeling rushed, right? So I wrote rushing through patient rounds, not asking for help, right? So not seeking that support, focusing in on the mistakes I made, right? Just that iron focus on this is the mistake I made. That's all I'm thinking about. That's all I see right now. Doubting oneself, working in a disorganized environment, providing inadequate support for residents. So I was trying to think about it both from like the physician side and the resident side. Being isolated, so maybe not receiving that support or not giving that support, and then the poor communication. Good. So I like to think if all of these were in place, if all of this was happening, it's kind of like a recipe for a worst performance, right? It's kind of vague, nondescript because it's general. It might not be specific to each of you, but probably wouldn't go out and excel in whatever domain that we're in, right? So let's flip the narrative. What about for your best performance? When you are at your best, what's happening? Let's hear some ideas. So we've gone through some examples for a recipe for your worst performance when you're performing at your worst, and what that might look like for you, and a recipe for your ideal performance. So when you're at your best, what does that look like? What does that consist of? And I was just sharing with the group that I do this consistently or ongoingly with athletes. It's not just a one and done when I'm working with them. So to continually develop our self-awareness, why would we want to return to this exercise? And granted, we did it kind of as a group. You may have gone off on your own and done it on your own, but as a group. But why would you want to return to this, let's say in a year? I'll give you an example. I was going to give it to you before. I've worked with a now professional athlete, worked with them when they were a varsity athlete. So we worked together, I think, for 7 years. And I think we've done this exercise on 4 different occasions. Why would we return to it? Different expectations, different environments. I mean, in the sport world, different competitive level. Yeah, so just different environment for sure. Any other reason? That's one of the big ones. I'd say there's 2, I think. So the environment and expectations might change. Good. So you're definitely going to become more self-aware, right? Because you're going to know, oh, that's my strength. I need to do this. You can almost make a little routine out of it. I need to be well fueled, well rested, well researched, good communication, so on and so forth. Good. 100%. So the environment changes, the demands change, and I change. Right? So I'm constantly growing. I'm constantly evolving. My strengths are going to, hopefully I'm continuing to build on my strengths, maybe even building on some of my areas of improvement type of thing. So reflecting on this and knowing when am I at my best and how can I make that my default? I always say to athletes, like when we go out on the court, field, etc., you want this to be your default. You want to be performing at your best all the time. And then we back it up. What do I need to do to be able to do that? Good. So this again is that sort of restructuring approach, that recipe exercise. It's not changing Alex's scenario with the patient, but can Alex pause, do some self-awareness? Where am I at? How can I maximize on what I need to be doing to be at my best? Again, it might not change the outcome for the patient, but how might he be able to restructure the scenario? We can also engage in energizing approaches when we're talking about managing setbacks and failures. So we want to create optimal activation, perhaps. Some people need to be very relaxed, as we were just learning as well, right? So things we can be using are like imagery. So we can be using imagery scripts. You could be using imagery to image doing a clinical procedure. You could also be doing things like self-talk. So self-talk was mentioned already. Self-talk, inner dialogue, the things that go through our head, or sometimes they're said out loud as well. That inner dialogue that we have to ourselves is so, so powerful. I always use this with the kids that I work with. If I say, think about a pink elephant, what are you thinking about? And then you get a smart kid who's like, I'm thinking of purple turtle. I'm like, no, you're thinking of a pink elephant. Don't lie. But so the things that we say to ourselves in our head impact what we're doing, impact our performance. So if we're questioning my abilities and I shouldn't be here and I can't do this and he's going to get mad at me again and I wasn't told what I should be doing, now go out and thrive, right? But or can we be flipping the narrative? Can we be really intentional about what we're saying to ourselves in our head? So some self-talk strategies. Really, it's about getting a handle on what are the things that you're saying to yourself in your head. And again, it's not always about flowing paragraphs, articulate sentences. It can be like cue words or keywords, just that are your go-to words, right? So our inner dialogue often, or does dictate how we show up. What we're saying to ourselves does matter. And there's various things that we can be doing to control our self-talk or manage our self-talk. So just as a couple of examples, there's affirmations. And I always think of all like the social media videos of there's like a 6-year-old girl like in a mirror, like doing like positive affirmations. And it's the cutest thing in the world. But legitimately, to kind of boost your own tires, give yourself some positive affirmations, right? So these reinforce self-belief, these reinforce confidence, and it doesn't need to be in a fake or fabricated way. It's just in an affirming way. So saying things like I'm continually learning and improving if we're going through difficulties or setbacks. I have the skills to handle this situation. So like kind of reassuring yourself, I can get through this. I can get through this. I have the abilities to do it. Countering is another self-talk strategy. So countering, really using facts to counter negative reasoning or negative thoughts that might come into your mind. So imposter syndrome, very prevalent in academia. I'm guessing prevalent in medicine as well, right? So I shouldn't be here. They're going to take my job away from me. They're going to catch on that I'm not good enough to be here, right? Very rampant. Not helpful thoughts to be putting in our brain. So you refute that, right? You're like, no, like, here's why I deserve to be here. I've done what education? I've done what training? I've showed up to sessions at 7 a.m. and listened to a sports psychology person talk about this stuff, right? So refuting that, like being your own devil's advocate to counter that negative self-talk. Thought stoppage. This is a big one that I work with athletes because they often can't get a handle on their thoughts. They almost spiral, right? So one negative thought leads to another negative thought leads to another negative thought. Then it's kind of reinforced because I just made a mistake. Well, of course you made a mistake because you have a negative thought in your head. So stopping that thought. So it's becoming aware of when you're having a negative thought and doing something so you become aware of it. It might be as simple as saying to yourself, stop, or tapping your leg. And the amount of times you tap your leg, you catch on to, I have a lot of negative thoughts. There's a famous sports psych study where a researcher had an athlete they were working with. I think he had a pocket full of paper clips. And the athlete was like, I don't think I have that much negative self-talk. And he said, every time you catch yourself having a negative self-talk, you need to take one paper clip and put it into the other pocket. And his pocket like shifted immediately. So he wasn't even aware of how often he was having negative self-talk. So by doing an activity like that, you can become aware of like, well, I'm probably not my biggest fan. What can I be doing about that? And so that's where things like the affirmations can come into play, or changing the negative thoughts to positive thoughts and being really intentional about it matters. And again, this isn't about being all sunshine and roses, and it's not even about having a performance consultant to tell you what to say to yourself, because it has to be genuine, has to be authentic and tailored to who you are, right? So changing your negative thoughts of I can't handle this to this is challenging, but I can find a solution. Might be too long worded. A lot of the athletes I've worked with come up with like taglines. Like I always use the cheesy one, like, just do it. And they're like, they laugh at me. They're like, yeah, this isn't a Nike commercial, Leah. So they come up with things that work for them in those clutch moments where they need something to kind of help them propel them, maybe through a setback, whether it's through training for them or a grueling experience. But it's getting a handle on our self-talk, identifying when we're having negative self-talk, stopping it, replacing it with something else. So that can be an energizing technique, but it can also be a relaxation technique, because what we're choosing to say to ourselves can be calming, right? I'm calm in this moment. Or it can be really intentional, like rooting yourself in, like I feel the ground under my feet. So you can be kind of combining techniques too, right? So what are we saying to ourselves in our head? That was a mindfulness technique, feeling the ground underneath you to really root yourself in and be present rather than, worrying about what's to come into the future. So maybe Alex could be doing some self-talk, right? To try and maybe in the moment, not feel those negative emotions that might be holding him back, as in the opening scenario. And then there's the last category. So there's reduction approaches, restructuring approaches, energizing approaches, preventative approaches, as ways that we can be managing setbacks and failures for coping. So we can also be doing, can we just prevent the stressor from ever coming, right? Well, wouldn't that be nice and perfect in the perfect world? This is often referred to as problem-focused coping. So we've talked a little bit about emotion-focused coping. This one's actually focusing on the problem. So planning, having a routine, As an example, we worked through that recipe exercise. Once you've identified, give yourself the permission to do the exercise on your own versus this kind of large group brainstorm. Once you've identified that recipe for your best performance, how do you get there? What's your routine before you go on shift or before in the morning or whenever your day starts, because you all work different hours? How do you get there, right? So that would be the planning part. In sport, we call that oftentimes like a pre-competition routine. What am I doing to get into that space to be at my best? And then there's also proactive behaviors. I call them either if-then scenarios or challenges and solutions. Challenges are going to come up. What am I doing to solve them? Or how am I intentionally responding to those challenges so that I don't just have a knee-jerk reaction and I spiral and nothing's going according to plan? So trying to have a plan. If this happens, then I will what? So I came up with a couple of examples, and you can help me fill in the blanks. If I make an error or a mistake, the most broad challenge ever, what can you do? Fill in the blank however you feel accordingly. If you make an error or a mistake, what can you do? Good. Acknowledge it. Be aware of it, right? Be aware that I made the error. Acknowledge that I made an error. I like the and how can I improve for next time to not make it again? Good. Super generic, I know. That's why you're all like, well, what context, Leah? When have I made the error? Was it in surgery? Was it in a communication? What level was the error made? How about this? Oh, sorry, I forgot that I had another box there. The thens, the solutions, they can be a wide assortment of things, right? So it can be a lot of the practical strategies and solutions that we had identified even earlier. It could also be more of those mental, psychological techniques, some of the things we've been working through as well. So it's thinking through what would I do in these scenarios? What if you're struggling to master a new, what did I write? Master a new clinical skill or procedure. What if you're just struggling to learn something new? Reach out for help. Good. To who? Yeah, talk to someone with more experience, a colleague, an attending. Good. Anything else you might do if you're struggling to master a new skill? The reason I'm asking for a second one is because I often make the athletes I work with come up with two solutions, because what if solution A isn't an option in that moment? Good. Practice, practice, practice. Good. So commit to practice. So I'd say, the sports psych person would say, return to goal setting, set a goal. How many times am I going to practice this each week? And then track it, right? So being really intentional about, so if I want to get better and not make the same mistake, and I'm struggling to learn a new skill, practice, 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 hold myself accountable, set a goal, track it. Good. What are other challenges that can come up? What are other ifs? What if I fail in completing a task? Good, thank you. What are the solutions or the thens? You fail in completing a task. What do you do? Good, thank you. So maybe giving yourself the permission to take some time, some space to reflect introspectively. Okay, what went wrong? How did I fail? When did it happen? What could I do differently next time? So give yourself the permission to reflect on making it a learning opportunity. Good, thank you. What's another challenge or another if? Because I've intentionally left them open because not in this area. What's another challenge you experience in your daily professional life? A negative interaction with a colleague during a stressful situation. That gives me anxiety just saying it. Thank you. What do you do? What's your plan if that happens? You've had a negative interaction with a colleague, it's a stressful situation. How are you intentionally responding, or what are you doing? Good. So let's use some of the techniques we were introduced to, right? So take that deep breath. Maybe it's that diaphragmatic breath so that I don't just automatically call them out and cuss them and curse them and then feel really badly about the scenario, maybe make it worse. Take a breath, give it a moment. Thank you. What else might you do? I know I like to find a table and flip it out of rage and be like, this is outrageous. That might be a bit more, I'm kidding, I don't do that. A bit more of a knee-jerk reaction, right? So what could you do in that scenario that's maybe an adaptive, constructive, professional response? Good, thank you, right? So if it's possible, am I able to just remove myself from the situation right now? And then later, I don't want to be like, I'll deal with it later, but maybe in the moment, the best thing to do is just remove yourself. Thank you. So you'll see that on the slide I've written, focus on what's in your control. There's probably lots that's out of your control. Again, many professional domains, performance domains, there's lots that's out of our control, right? The reason we do if-then challenges solutions is to try and be prepared, as prepared as we can be. So we've thought through the challenges that can come up, so that when they do come up, you can go, I have a plan for this. I know how I'm going to respond to this scenario. I was working with a Paralympic athlete who, like, the challenges solutions were her jam. Like, she had solutions up the wazoo, planned out everything, thought we had it covered. She went to the international competitive site and arrived on site and went to make her, I can't remember if it was her pre-competition meal, and there wasn't a microwave in her hotel room. She didn't have a plan and she spiraled. So it sounds silly, like, why do we think of all the challenges and solutions that can come up? But it's so that you're prepared. So she had never thought of, well, I'm not going to be able to be prepared to be fueled. Well, in a performance domain, as we've talked about, you need to be appropriately fueled, right? So that's kind of the summarized version of it, but it matters. And to focus on the things that we can control, because you can't always control your colleagues' outbursts. You can't always control how you're receiving feedback, if you get any feedback. You can't control these types of things, right? But you can control how you respond to them. And that's always my kind of secret message is you can't control the situation necessarily, but you can control how you're responding. And whether that's like a psychological, mental coping technique to get you through it, or if it's like a practical consult with colleagues technique, having a plan is what's important so that you can appropriately respond to this scenario. So thank you for your audience participation. Looking at the time, okay. I want to work through one more additional approach. Because in my introduction, Henry talked about this idea of self-compassion. And I want to talk about a compassionate approach. So a compassionate approach is a little bit of a different, newer technique when it comes to mental performance. So I have one more scenario for us. How about a compassionate approach? Imagine the following. A close friend or family member, Dr. Sarah Lee, is a dedicated resident in a highly competitive surgical program. She's been working tirelessly to prepare for a critical surgical board exam that could significantly impact her career trajectory. Despite her hard work and potential, she does not pass the exam on her first attempt. Dr. Lee feels like a failure, worries about her future in surgery. I'm liking the laughter because I feel like this is relevant. She begins to question her abilities and whether she is truly cut out for the demanding field of surgery. The disappointment, understandably, weighs heavily on her. She struggles to find the motivation to continue preparing for the next attempt. So this is Dr. Sarah Lee. She is a close friend of yours, or maybe even a family member of yours. What do you do? Sarah's your close friend. What do you do? Well, then how appropriately timed is this? Well, I got a feeling. I was seeing laughter and eyes looking around. So we'll work through it together. So let's pretend it's someone else first. So maybe it's your colleague or maybe it's your close friend. What do you do for Sarah? What do you do? Good. Make yourself available for your close friend or close colleague, right? Just let them know, like, hey, I'm here. We don't even have to talk about the results. We can if you want, but if you just want to hang out, like I'm here for you, basically, right? Good. Thank you. What else might you do for your good friend, your good colleague, Sarah? Good. The identity piece is so big. Professional athletes really have their identity wrapped up in like winning big competitions too, right? So absolutely. So maybe what you do for Alex, thank you for sharing that. You try and maybe not like in a teaching way, but somehow try and help them remember, like, you still have self-worth. Like, yes, you might not have passed this on your first attempt. Where else do you have worth? Like, where else do you have value? Because you do. It's not just this. Thank you. Maybe a hard conversation to articulate, but I really like the idea about it. Excellent. Giving people space to talk. And your point about too often we advise people is so well taken. When I'm working with coaches, teams, I'll often say, like, can you just be present and let them decide if they want advice or not? What do you want me in this role right now? Do you want me to be a soundboard? Do you want me to give suggestions or advice? Like, ask them, what do you want from me right now, right? Thank you for that. They might not want your advice at this point. Good. Would you do anything tangibly to help Dr. Sarah? Can't remember the name. Good. So share that common humanity. Look, similar experience was had with me. Here's how I navigated it. Maybe that could be useful. Good. Any other tangible, right? So we've kind of said we'd be there, give space, shoulder to cry on type thing. Don't mean to say that's cheesy. Could you practically do anything for Sarah? They're not going to like go and like, I'm going to change the results of the exam, haha. But like, could you do anything to support her practically? Thank you. Yes, right. So helping once they're ready, helping walk through what are the next steps? Practically, what am I doing to pick up my socks and move on to the next thing and not just kind of like wander in the abyss of this like lived failure experience all alone. Good. So maybe help them map out practically what's next. Love it. I'm right there with you. Terrible golfer. Just a top golfer the first time. Not good. Right. So can we go do something? Sarah, like that's real, like that sucks. Like I recognize that's a tough situation. You want to go do something? You want to go hit around of balls at the driving range? You want to go shopping, right? Like what do you want to go do? Right? Yeah. So can we be there to actually like show them our support in various ways? Thank you. I like that. So what this is getting at is this idea of compassion, right? So compassion, I always like to sort of define compassion as acknowledging the suffering in someone else or the struggle in someone else and wanting to do something to help alleviate it, right? We're compassionate. Like, Sarah, that's tough. What can I do to help? Can I be an ear, shoulder, map out steps, go golfing? Like, I acknowledge your suffering and I want to help. That's compassion. And then self-compassion is doing that for ourselves, which we so rarely do. Self-compassion is recognizing the struggle and the suffering that we're going through and wanting to do something about it as well. So it's a different, mental way of thinking about things, compassion turned inwards. Has anyone heard of self-compassion before in the room? Not seeing, I saw a couple of head nods. Okay. So Kristen Neff brought the idea of self-compassion. It's like a Eastern Buddhist practice over to the Western psychology world at the turn of the century. And then a few short years later, we brought it into like the sports psychology domain and it has really boomed. Self-compassion, according to Neff, consists of 3 components. Mindfulness. So you have to acknowledge that you're going through a difficult time. Alex, in the opening scenario, has to acknowledge like, yeah, this is tough. I'm struggling right now. Just like we would notice that Sarah's struggling right now, and that's a difficult scenario. So mindful awareness of the situation, common humanity. So once we've recognized that we've had a difficult situation, trying to be like, how do other people experience this too? Have other people experience this too? That's not to take away the unique harshness of it potentially, but just to not feel isolated and alone. Countless people have failed this exam before. I'm not alone, right? Doesn't make it better, but just gives you a little bit of common humanity, that relatedness with others. And then self-kindness. What can I do to be kind to myself instead of harshly, debilitatingly criticize myself or kick myself when I'm down? So self-compassion, recognizing that there's a struggle going on with mindfulness, remembering that we're not alone in that. No one signed up to be perfect in this world. And then self-kindness. What can I do to care for myself in this difficult moment rather than berate myself critically? We're going to do this one a little bit quicker, which it is a quicker one. I want us to try out self-compassion because it's actually tricky. I've been researching self-compassion since 2007, and I struggle with it. It's probably why I research it, right? So let's do a quick little self-compassion exercise to let you try it out. So I wrote record your responses, but you can just think about your responses in your head. You're all very capable, competent of holding ideas in your brain. So 4 prompts. Prompt number 1, I want you to think about a time when a close friend or family member or colleague felt really badly about themselves. So close friend feeling badly about themselves. And I want you to think about how did you respond to them in that situation? And think about what did you say to them? What did you do for them? So just bring to mind, and I won't ask you to share this one, bring to mind close person in your life going through a difficult time. How did you respond to them? So park that in your head. And then I want you to think about a time when you felt badly about yourself. And I want you to recall, how did you respond to yourself in that situation? So you were going through a hard time. You felt badly about yourself. What did you do? What did you say to yourself in that scenario? Again, I won't ask you to share. Just think about it. And then just a little compare contrast, holding those ideas in your mind. Did you notice a difference in your responses to the first prompt and the second prompt. So what you said and what you did for your close friend when they were going through a bad time versus what you did for yourself and said to yourself when you were going through a hard time. And then the fourth one is just thinking, what if I treated myself the way I treated a close friend who was going through a hard time? And that's what the idea of self-compassion really is all about. And this exercise, granted, I flew through it. I usually get athletes to like write it out and tell me what you say and what did you do. And then we compare and contrast, and it's like a light bulb goes off and they're like, I'm such a jerk to myself. Like, why do I say that to myself? But to my friend, I'm right there for them to support them. Or even I've heard the tone of my voice when I'm talking to myself is so much harsher than like the compassionate, kind, caring, empathetic tone I have when it's my friend who's struggling. So really thinking about, could I be treating myself the way I treat a good friend when they're struggling? Can I do that for myself? So why not try treating yourself like a good friend and see what happens? This very quick exercise was taken from Kristen Neff's website. That's how I said brought self-compassion over to Western psychology. And her website, selfcompassion.org, I promise I'm not getting paid for acknowledging that. She has so many exercises, practices, audio guided meditations, journal exercises, body, physical exercises. I use a lot of these with athletes because they really resonates with them. So treating ourselves how we would treat a good friend. There's a lot of research that's been done on self-compassion as to why we would do this. And in the sport domain, what we found is that individuals who have higher levels of self-compassion, so they kind of treat themselves how they would treat a friend is one way to think about that, or they have mindfulness, common humanity, and self-kindness, they have high levels of self-compassion, they have a lot of adaptive characteristics. So they have more adaptive coping to stressors, help-seeking attitudes, greater initiative, greater perseverance, so on and so forth. So lots of good advantages come from being more self-compassionate. And at the same time, a lot of the things we don't want are reduced or lower in folks with high levels of self-compassion. So less likely to just use avoidance as a coping strategy, less concern over mistakes, fear of failure, passivity, harsh self-criticism. So self-compassion is a good thing. And the reason I bring kind of the science behind it is because it's a lesser known kind of mental technique, mental strategy, but really it facilitates an adaptive response to demanding scenarios. So if we respond to a situation by going, I recognize this is difficult. I'm being mindful. I'm not alone in this. Other people have experienced struggles. What can I do for myself to care for myself? Self-kindness. If we're doing those things, we're more likely to have adaptive thoughts, so adaptive cognitions, adaptive emotions, and adaptive behaviors. So I bring up self-compassion. I share with you some findings from sport. Here I am talking about sport again, right? And you're like, what does this lady know about the healthcare profession? And again, my answer is very little. But if you do a little Google search of self-compassion journal articles on self-compassion in the healthcare profession, these are just the ones I grabbed on like my first perusal of it. So it's a little teaser to maybe get you to explore self-compassion a little bit more, because there really is a lot of accumulating evidence as to why we might include self-compassion in our professional practice. So when we're going through those demanding experiences, can we be self-compassionate? Is it going to change the outcome of a patient's trajectory? Probably not, but maybe, because maybe it's going to give you the clarity that you need, the seeking support that you need from those mentors in order to give them the best primary care. So self-compassion, another one that I encourage you to add to your toolbox. So in closing, my kind of key takeaways, thank you, you were all great, by the way, get to know yourself. Right? So when am I at my best? When am I at my worst? What's my plan to be at my best? Maximizing on your strengths. So when you're going through those setbacks and those challenges and failures, how can I be maximizing on my strengths to work through those challenges? And then I always like to say, the golden rule was to, treat others the way you treat yourself. And we've really flipped that with self-compassion. Treat yourself the way you would treat a good friend is really how I like to think about it.
You've been listening to Airway Breathing Conversation, a podcast hosted and presented by the anesthesiology residents at the University of Saskatchewan. Please note that while this podcast is run by healthcare professionals, it is intended for educational and entertainment purposes only. We are very thankful to our guests for taking the time to share their wisdom with us this episode, and a very special thanks to you, our listeners, for tuning in. Don't forget to follow us and our associated USask Anesthesia accounts on social media. You can find all our social media links on our Linktree page at linktr.ee/abc_podcast. You can also find the department's social media links on their Linktree page at linktr.ee/usask_anesthesia. We'll see you next episode, but until then, stay calm, take a breath, and always remember your ABCs.